Healthcare costs, doctors are the problem. It is their fault healthcare costs are so high. Copyright Terry Mercer, 2011, 2017. Did I get your attention? Many people have strong feelings on this topic, and will initially agree or disagree. At this moment, with that statement, I personally disagree. My premise is that the doctors are often actually victims, to a large degree, a scapegoat. Just as the general public is. I'd like to show you why and how doctors are not the problem. As so many in Congress, and the MSM, mainstream media, want we the people to believe. However, having worked around doctors, in the nutrition industry, both on the human and animal side, the last 20 years, I have had to learn and follow FDA guidelines. I actually have had to see, read, study, and comply with the FDA government regulations, controls, that increased costs and slowed production, while not really benefiting the consumer, or stopping false marketing scams, like those claiming liquid joint replacements, or quick cures, or eliminate surgery. Because, in reality, that is just not how nutrition works. Frankly, the government intimidation and rules compliance is a very real cause of increased costs. Second only to malpractice insurance. Next in the list as to why healthcare costs are so high, here in America, is tort lawsuits. I'm not talking about the lawsuit where some doctor accidentally cut off the wrong leg, replaced the wrong joint, removed the wrong kidney, but the class action type stuff. You know, I'm sure you have seen the television commercials seeking people that want to sue. But at the end of the majority of those exercises, the attorneys make millions. The government makes millions. And if the actual victims are lucky, they might get a rent or mortgage payment or two out of all their effort. And a free replacement or redo, if they are still alive. I haven't looked at the math in a long time, but these type of lawsuits absolutely increase the fear, and are a key reason why malpractice insurance costs are so high. Therefore, I would place tort at the top of the list of things to change. If lower medical costs, and lower health insurance costs, are truly the goal. Another interesting article, from the FDA, regarding dietary supplements. Dietary supplement products and ingredients. The Federal Food, Drug, and Cosmetic Act defines a dietary ingredient as a vitamin, mineral, herb or other botanical, amino acid, dietary substance for use by man to supplement the diet by increasing the total dietary intake, or a concentrate, metabolite, constituent, extract, or combination of the preceding substances. Unlike drugs, supplements are not intended to treat, diagnose, prevent, or cure diseases. That means supplements should not make claims, such as reduces pain or treats heart disease. Claims like these can only legitimately be made for drugs, not dietary supplements. Dietary supplements are marketed in forms such as tablets, capsules, soft gels, gel caps, powders, and liquids. Under existing law, including the Dietary Supplement Health and Education Act passed by Congress in 1994. The FDA can take action to remove products from the market, but the agency must first establish that such products are adulterated. For example, that the product is unsafe, or misbranded, for example, that the labeling is false or misleading. Those are directly the words from the FDA. The primary issue with the FDA, and DSHEA, is a double-edged sword for the citizens. On one hand, the FDA targets claims and tries to enforce some resemblance of public safety through required testing for drugs. For any science type or business to claim anything actually does anything to prevent, treat, or cure anything. Frankly, honestly, it is closer to a restraint of trade in many cases, favoring the big farms and deep pockets to the small researcher, the nutritionist, or even the clinical doctor. A supplement manufacturer, cannot legally claim to prevent, cure, or even treat anything. The moment the claim is made, regardless of the science behind the claim, the FDA classes it as a drug. Which, in reality, is utter and complete nonsense. There is science and decades of studies that prove certain nutrients help the body do exactly those things. Prevent, treat, and even cure. Vitamin C has been scientifically proven to cure, prevent, eliminate, treat, or drastically help over 30 common diseases. Very real and serious human health issues. The discovery of vitamin C occurred after centuries of the search for a scurvy cure. Here's a list of some of the real things vitamin C has been scientifically proven to help. Treat, cure, prevent, depending on the disease, issue, severity, dosage, form, and individual body. Pneumonia. Encephalitis. Herpes zoster, shingles. Herpes simplex. Mononucleosis. Pancreatitis. Hepatitis. Rocky Mountain spotted fever. Bladder infection. Alcoholism. Atherosclerosis. Ruptured intervertebral disc. High cholesterol. Corneal ulcer. Glaucoma. Schizophrenia. Burns and secondary infections. Heat stroke. Radiation burns. Heavy metal poisoning, mercury, lead. Venomous bites, insects, snakes. Multiple sclerosis. Chronic fatigue. Complications of surgery. Some cancers. Leukemia. This seems like an impossible list of vitamin C cures, doesn't it? At this point, you can either dismiss the subject or investigate further, that is completely up to you. A natural cure for heart disease, as described by Dr. Linus Pauling, holder of 48 honorary Ph.D.s, the world's only two-time unshared Nobel Prize laureate, and the founder of modern chemistry. Dr. Pauling was unequivocally certain that too little vitamin C leads to elevated cholesterol levels. Especially the LP variant of LDL, so-called bad cholesterol that causes plaques in blood vessels. His unified theory of cardiovascular disease constitutes one of the greatest potential breakthroughs of modern science. Yet this remarkable theory, and its intriguing claim that very low-cost LP binding inhibitors will prevent and even dissolve arterial blockages, has been ignored by the pharmaceutical industry, the medical profession and the media. Take with or before meals, that is, split dose, taking 2 to 3 times daily. Natural agent vitamin C, as ascorbic acid 6 grams to 18 grams. Natural agent lysine 3 grams to 6 grams. Matthias Rath also recommends adding natural agent proline, 5 grams to 2 grams. Owen Fonoro recommendation to add natural agent CoQ10, 150 mg to 300 mg. As a manufacturer of nutritional supplements, I can't legally say those things on a product label, marketing material, or even in advertising. Sort of like that book, What the FDA Doesn't Want You to Know, which is chock full of some great information, as well as some incomplete information, because he does not focus enough on forms, types, or absorption. In the government's effort to control the snake oil salesman and limit the numbers of potentially bad product pushed out a door, they've created an injustice, promoted ignorance, and enabled the big pharmacological companies to flourish, using drugs versus natural, normal, available, and alternative cures and treatments. Most everyone remembers the late-night commercials of Dr. Barefoot peddling his wonder supplement, Coral Calcium? Well, coral was just in name, not the product. And that particular type of calcium that he was selling is the least bioavailable, usable, to the mammals, human or animals, body, just another form of calcium carbonate. While what he was saying about calcium is true, if the right type of calcium is used and has its necessary nutritional contributors, magnesium, boron, zinc, and if the body doesn't get outside or has other issues, vitamin D are included. He failed to mention that the absorbency of his type of calcium was limited to about 10% of the number his label claimed. He failed to acknowledge that his numbers were combined amounts, versus elemental amounts. Because of milk, he implied and stated that liquid was the best form. Failing to note that certain nutrients, such as vitamin C and glucosamine, aren't stable and break down in liquid. Cease to exist, have decreasing potency, and sometimes interact with the other nutrients in ways that allow them to completely transform into something completely different than intended or initially thought. But, those were not any of the reasons he was finally, legally, shut down. Nope, it was because he continued talking about the cure and treat issues. Not because he was claiming his product would do things it couldn't, or wouldn't. With the forms, or formula, he was using, calcium carbonate. It had nothing to do with the potential of fraud. Selling a product that couldn't meet the claims. Sort of like claiming if a gas can is stuffed in your fuel tank you'll get better mileage. Just because it's a petroleum product. He was not taken down for claiming it was coral calcium. Despite coral being illegal to harvest for decades now. Or that it was really just ground up sand. Which may have had some fraction of coral in it. Depending on where it came from, although unlikely. Nope, he was taken off the air for making drug claims. Scientifically proven and true claims. Just not with his product or ingredients used in this product. Which only fueled the misinformation. The controls of the government power. And fear in supplement manufacturers. In order to legally make claims on any product, a scientist falls under the FDA's drug guidelines. Which is clearly something only multi-billion-dollar corporations can effectively do. Because, to get a drug approved for human use is wildly time, effort, and financially consuming. The current time frame being 7 to 12 years after discovery and initial testing. And the cost being often over $1 billion per drug claim. Yes, you heard correctly, upwards of $1 billion, $1 billion, per drug claim. Ridiculously expensive, and massive amounts of repetitive work, tests, and what-if scenarios. And, as you've seen with the assorted class action lawsuits, having that approval doesn't offer the farms that could afford the approval process any additional protection. Nor is there really any greater protection for the consumer. Further, the FDA doesn't really pay any attention to the reality of known issues. Or heavy metal contaminants that have massive long-term effects, and are pretty simple to test for. If they did, the majority of drugs manufactured in parts of the world we, Americans, wouldn't and couldn't drink their water, wouldn't be allowed to be imported into the USA. Vioxx is a great example of an approved drug that did nothing to really treat, fix, improve, or cure the issue. Its sole purpose was to block pain, allowing the condition to actually get worse. While the patient had a false sense of security. Zero healing. Just a COX-2 inhibitor that told the brain there wasn't pain, while causing heart issues in a percentage of its users. It is now banned for sale in the USA, and billions of dollars in lawsuits paid out. Billions. And people want to know why meds are so expensive? Or believe all farms are the problem? Nope, and sadly, that billion-dollar number does not include the R&D, research and development, the patent, or the assorted testing costs. Just to get the FDA approval in the first place. In the long run, the FDA approval kept the government at bay, for a time. But was otherwise totally worthless. Hey, but that was a FDA-approved drug. Didn't help save citizens, protect patients, or even the big pharmaceutical companies. Personally, I think reasonable and responsible testing should be done. Information from the users consistently be gathered via internet database. And verified if serious and actually tied to the use of that drug. contributing factors, side effects, caused when mixed with other combinations of food, nutrition, medication, or physiological issues, like diabetes, high blood pressure, thyroid, or diseases, should be ongoing for drugs. The database should be something any doctor, treating a patient, should be able to add to, question, and speculate on. Any combinations that might potentially cause, or not, side effects or problems should be listed. Especially when not specifically tested for, or experienced, in the safety studies, laboratory, or research. Maybe a rational warning label should say something like, "Use at your own risk." This might help you with, insert problem or issue, and will likely have unknown side effects. See our website for details. If you begin experiencing difficulties, immediately consult your doctor. He might or might not know what to do. Continue at your own risk. Then again, it might kill you. But, some people have reported positive improvement by blocking or masking the symptoms, and few users have died, but some of them might have died anyhow. Use at your own risk. Ultimately, we are just trying to help, and don't wish to harm anyone, but every potential complication and combination has not been tested for. If you want cheap meds that may or may not help you, then assume some risk. And take some responsibility for yourself. After all, we're just human. We don't know everything, and again, we have not tested every potential contributing factor. Just those we felt most common, important, and likely. Best of luck. Get well soon. Diet and exercise can help in most cases, but again, consult your doctor, because we do not know you, haven't seen or tested you, and frankly do not want to be liable for you. Use our products at your own risk. That sounds like a great warning label to me, honest, to the point. And rationally accepting the billions of potential combinations of contributing factors that no reasonable testing can ever cost-effectively take into account. While I am not for the cruelty of animals, I'd rather 10,000 rats, dogs, and monkeys die testing a drug that might be given to my child. Or yours. Than blindly hope that it's not going to mess up my child. I'm all for humane, but clearly understand the need for animal testing. And frankly, all those people against animal testing should be banned from using any drugs and treatments that were deemed safe because of mammal testing. It wouldn't take long for those people to have a whole new, and better, more honest perspective. Sadly, FDA approval doesn't mean safe or without major issues. But, many of those same people need those drugs just to be somewhat sane. Any synthetic chemical drugs released without reasonable safety tests that aren't tested on animals first should also be banned. Common nutrients, vitamins, minerals, trace minerals, ultra-trace minerals, amino acids, and enzymes, commonly found in, or researched and studied for years, should be able to state exactly what they can do within the average body, and not require further testing, other than product safety, such as salmonella, E. coli, and heavy metals. It is irrational, unreasonable, and impractical for people to be tested on first, and hope, blindly, that a certain product might work, without negative side effects, contraindications, or death. Most drug reps are just trained parrots. They know only what they are told to know. And most don't bother to read or research outside the propaganda their company gives them. For the first 3 years I was involved in this industry, I did not want to learn about all this stuff. And merely handed stuff out, as most starting sales reps do and would. Then I became aware. And while I don't know everything or lots, I've studied very hard on joint, digestion, and repro issues. How our products work, why they work, and how they compare to our competitors. I've also been taught some about broad-spectrum foundational nutrition. This is one of the advantages of working with a group of medical doctors, veterinarians, and nutritionists. I've also learned that the more I learn, the more jaded I get with some of the products, and companies, on store shelves. It's sometimes depressing to see what crap is sold to the American public. And the claims those companies make, or imply. In reality, iron oxide is really just trust. Calcium carbonate is limestone or sand. Personally, I refuse to do business with supplement companies that use those ingredients in any of their products, because it demonstrates that they don't care about the quality, effectiveness, or bioavailability of their products. They are going for profit, cheap, and easily available. Not the best choice. Though it helps keep their costs down, and their profits up. And their customers moderately feeling better. There are 50 years of studies on glucosamine. Dozens proving it is not stable in liquid form. Especially not the glucosamine HCl form. Yet, most Americans fail to understand that. Far too many supplement companies continue marketing a scientifically false claim that liquid is the best, or works, or is capable of healing anything. That isn't true for all nutrients. There are multiple studies that prove that glucosamine HCl must be converted to a glucosamine sulfate within the body, for the body to even use it. Yet the HCl form is still the most common on store shelves. Over 20 years later. Even after the infamous GATE study, spanning nearly a decade, involving multiple universities, and thousands of subjects in a double-blind crossover study, proving the marketing claims and benefits of glucosamine HCl are not real, and doesn't really work. Not scientifically proven. And, even more importantly, actually and repeatedly proven false. Despite the fact that the absolute best glucosamine HCl on the market, patented manufacturing process, has shown at least 50% to end up in the feces within 24 hours, thus not being used by the body. They have celebrities endorsing their product, despite the science. Talk about smoke and mirrors and avoiding reality. Science has proven many things over the years. Vitamin C has a 30-day half-life when added to liquid. Unless it's 100% all natural. That is, orange juice. Yet, it is a required supplement, the human body does not make it. It can only be gained through diet, food, or supplementation. Vitamin A, in its raw form, is easily overdosed on. Hence beta-carotene's purpose and benefit. A healthy body will convert the beta-carotene it needs to the vitamin A it requires, if enough is there, and cannot overdose on beta-carotene. HA, hyaluronic acid, is made from rooster combs or cow eyeballs. It is a suspected COX inhibitor, and proven that the majority of it is molecularly too large to be used by the joint tissue, unless injected directly into the joint. Veterinarians and orthopedists have been injecting it directly into the joints for years, noticing no serious or positive results when injected into the muscle or even the bloodstream. Seriously, if you can't get it to work by injecting it directly into the bloodstream, what logic implies that there is any high function or benefit when being ingested and subject to stomach acids and the digestive tract? Chondroitin sulfate is made up of ground-up cartilage and hooves. The patented processed form, considered the best of its type on the market, has shown that 70% is in the feces in 24 hours. It seems like an ineffective use of your money. Wasting it on ingredients that merely pass through the body. People need to learn that there is a difference between it works. Does it work because it's masking or covering the problem, or because it's treating the underlying issue? Another huge one to learn about is the claim it's all natural. Remember, so is mercury, but it will kill you. So is poison oak. Again. If you try eating it, it can kill you. All natural claims in nutritional supplements should be limited to what is in a healthy body already. Vitamins, minerals, trace minerals, amino acids, and enzymes. And those nutrients that a normal body ingests. Like MSM, biologically active sulfur, naturally found in red meat and dark green leafy vegetables. And not some plant, rock, or animal matter. Just because white willow bark is natural, it's not natural to the human body. It is an herb, and while effective as a painkiller, it also clearly fits in the RANS category. And shouldn't be misused, overused, or abused. RANS is the acronym for resistance or immunity, addiction, negative interaction with other medications or treatment, toxic buildup, or side effects. At least one of the RANS will eventually happen with all herbs and drugs when used daily for prolonged periods of time. Most people assume that it's the pharmaceutical companies that creates the huge costs in the American healthcare system. And there are some examples of that, especially with some multi-million-dollar executive salaries. But after being involved with the industry for over 20 years, I'm doubtful that they, or the doctors, shoulder the most blame. Most big farms don't like the cost, delays, or liabilities any more than the small companies and researchers that are kept out of being able to bring a new invention, formula or device, to market without a massive expense of time and money to comply with our own government. Instituting higher ISO standards and GMPs, good manufacturing practice standards, will easily block many of the small businesses from competing. Because of the additional costs, delays in bulk to marketable product, which has been discussed in the industry for a few years now. ISO and GMP standards are cleanliness and process standards, often portrayed as a clean room versus bathtub type of stuff. I'm not convinced that the big farms are the responsible party. I think a power-crazed, some out-of-control government agencies are. The FDA and USDA are partly to blame. But in reality, it is the tort, class action lawsuits, that are the real culprit. Those companies knowingly, and purposefully, selling dangerous products should be slapped, legally. And their victims should be compensated. Not a pile of lawyers. Not some government agencies. But the victims. And, frankly, if their actions are purposefully deceitful, fraudulent, and dishonest, then criminal charges should be brought against those responsible, not just fines. At this point, for the small researcher, the home or small business inventor, little supplement companies, the best they can honestly hope for is that their invention or formula is something a big company will be willing to purchase or license. Because, clearly they cannot afford the time or money to deal with the FDA and wastefully slow and ineffective government to get the patents, or approvals, on their own. Much less take a product or medical device to the market. Some things that research has shown effective with many, but not all, forms of cancer. Megadoses of vitamin D3. It's measured in international units, US, in nanograms per milliliter. The Vitamin D Council believes that a person's D3 levels should be at least 50 nanograms per milliliter for your body to function properly. Institute of Medicine's Food and Nutrition Board, FNB, also said that taking vitamin D in amounts of 10,000 IUs or more could be dangerous. But science shows that is a ridiculous assertion. Since just 30 minutes direct sunshine can give an adult more than 10,000 IUs. Since countless studies indicate that much higher levels of vitamin D are required for optimal health. It's no surprise that experts lost no time denouncing the FNB's recommendations. Megadoses of vitamin C. 6 to 10 grams split into 2 or 3 servings has shown to have a positive, helpful, effect on many forms of cancer. CoQ10 600 mg daily, 200 to 3 times per day, can help with most forms of cancer, and immune system dysfunction. Barley's cold-pressed flax seed. Mixed with cottage cheese, the activator. 3 times per day, has helped many cancer patients over the last 20+ years. Those are known, proven, and beneficial for many, not all, with cancer. Cutting doses to approximately 1/4 for maintenance, and 1/8 for preventive. Some additional pieces of information that might help you. www.nscois.com web link. Maybe some of that information might help you. Best of luck. For those thinking doctors are overpaid, think about the assorted medical professions for a moment. General practitioner usually has a constant reoccurring patient base. It took that person 9 to 14 years to become licensed. Surgeon, limited patient base, seldom the same patient twice or with any regularity. Huge potential liability. It took that person 14 to 16 years to become certified and licensed. Specialist, very limited patient base. Usually 7 to 15 years to become licensed to practice. LASIK, eye surgery. Something I initially didn't think would take too much time to become. Wrong. 12 to 15 years to become a licensed LASIK surgeon. A person only has two eyes, and once the surgery is done, that patient will have no further need for that doctor, or glasses, or contacts, or contact solution. But spreads the word to other people, who in turn help keep that doctor in business. And, in cities of 100K or more, an estimated 10% can use some type of eye work. Of which, 1%, 1,000 per 100K population, actually get anything done in the first couple years that practice is open. But the building, equipment, staff, taxes, malpractice insurance, etc. still has to be paid for. To exist. Regardless how busy the doctor is, or what is charged. And, so long as the city continues growing, people move in, children are born, and there aren't any major negatives from that doctor. They can have an effective practice, which should be self-sustaining for 20 to 30 years. Without repeat customers. Dentist, teeth. Chronic issues. Even teeth cleaning is recommended every 6 months. Most people do it every 18 to 24 months. Depending on the patient's diet and personal care, and genes, average person averages 1 to 2 cavities per year until about age 30. Then they either have a mouth filled with fillings, cavities, or dentures. Or have it down well enough that they only see a dentist as needed. Which makes dental work a necessity for most people, in most communities, and offers a lifetime practice. Generally it takes 6 to 8 years to become a dentist, with 10 to 14 years to be an oral surgeon. Chiropractic, spine. Chronic issue. Seldom totally fixes things. Only adjusts, helps, and suggests how to keep things in shape better. 75% repeat customer base, and lifetime practice. 7 to 12 years to become a licensed human chiropractor. Depending on the type and level. Disadvantages of a medical career. It requires a long and difficult study period. With long and irregular hours. In addition to practical and clinical sessions. Underpaid. Sometimes little or no pay. Internship or residency. While getting their license. And yearly continuing education seminars. For the latest technology, issues, and methods. Usually in some metro area they have to fly to. And book a hotel and rent a car for. Lasting a few days to a whole week. Every year. Working hours are usually long, including after-hours calls and emergencies. And this may put strain on marriage and family relationships. Disciplined time management is of utmost importance. In some countries, the risk of unreasonable medico-legal claims may exercise enormous psychological stress on a doctor. It takes a number of years to build a private practice that will be able to sustain you and your family, economically. Not to mention the stress and challenge to pay back all those student loans. Office and equipment fees for the practice, and the growing malpractice insurance costs. Though you've never done anything wrong, your personality must be able to psychologically deal with emergencies without panic. The occurrence of complications, as well as suffering and death as part your daily work. How was your day, honey? The spouse asks. Well, I had one come in with a smashed head, guts all over the place. We did everything we could, but it wasn't enough. We lost them. Oh, and 2 others. But we saved 1, and helped 14 others. How long do you think it would be for the spouse to stop asking, or wanting to know, about their day? Dollars. Average cost to become a licensed practicing doctor in America: $400 to $800,000. Just for schooling, books, and tools. That doesn't count the practice office, patient rooms, or other necessary equipment, which could easily run over $1 million before they've actually seen their own first patient, or really started to make a profit, or pay back those student loans. Think about what you would have to make, or charge, just to break even. Then, consider if you had to pay $4,000 to over $50,000 a month just for malpractice insurance before you made a dime, although you'd never had a claim filed against you. OB/GYNs and surgeons have the highest rates because they enter the body. Moreover, the deviation between low and high averages varies in Florida more widely than in almost any other state. For instance, a doctor in internal medicine in Florida could expect to pay in excess of $56,000 per year for insurance as of 2009, in contrast with Minnesota's $4,000. General surgeons paid in between $90,000 per year and $175,000 per year or more. OB/GYNs once again could expect the highest rates, with liability coverage ranging from $100,000 to over $200,000 per year. And you think doctors are the problem? Really? Doctors are not the problem. The attorneys pushing class action lawsuits. People expecting perfection and miracles all the time, and suing when they didn't get them. The legal system allowing known wrongs to be paid off rather than criminally liable. The judges in the tort system allowing attorneys to rake in millions, as the actual victims get fractions of pennies. The government that enables the abuse in the name of protection and a greater good. Agencies, like the FDA, USDA, and even the EPA, impact healthcare costs here in America. And the insurance companies, which are quick to settle especially frivolous claims. The juries that award based on feelings rather than a real understanding. All that, the combination of all of the above, is why human healthcare is so expensive here in America. It is not any one thing, but a combination that is really the problem. The insurance companies are. Because they've allowed the tort system to get out of control. They often settle, rather than fight. They want to make a profit, like any business. So they sometimes play games, and one such game they were repeatedly caught playing was the automatic denials of payment or coverage. They got away with it for many years, but the reality is they have been caught. And that part of their business model has to come to an end. Coverage denial for pre-existing conditions. That, along with the lifetime limits some of the insurance companies were placing on their insured, was the reason Obamacare was allowed to be pushed through to begin with. Reform needed to happen. The abuse of innocent citizens, innocent families in need, really did need to stop. Those two parts were the necessary icing the vast majority wanted, needed, and were the icing that masked all the government-growing negatives in the bill to slide through. Hopefully, a better way plan will honestly and responsibly address some of the issues. Because, if people continue targeting doctors, there will be fewer doctors. Many have already opted for an early retirement, many have jumped ship. Hundreds from private practice, to either retirement or a safer patent-free mode. such as research and development, teaching, authoring, or for some, even going to work for the government. Just because of the massive malpractice issuance costs. Really, it's long past time. Healthcare costs really are high in this nation. But it's not the doctor's fault. It's not just insurance companies. Though they do have some blame. A whole lot of it is tort and our own government. That is a sad reality. Wake up, America.